Hello everybody, my name is Lila Carpenter. This is going to be my presentation about how to prevent the spread of tuberculosis in your hospital amongst the patients as well as amongst the personnel. Let's first differentiate between inactive and active tuberculosis. In inactive tuberculosis, a person is infected but does not display active signs and symptoms of tuberculosis. Furthermore, they cannot spread the disease as quickly as somebody with active tuberculosis. An individual with active tuberculosis will display signs and symptoms of tuberculosis as well as be highly contagious and spread the illness. Let's go ahead and take a look at a couple measures in which we can prevent the spread in our hospital. One of the ways is to recognize when an individual is at risk of TB infection. One common risk factor for TB infection is recent travel to countries that have high rates of tuberculosis. Furthermore, immunosuppression is another common risk factor. Immunosuppression can result from many different causes, such as HIV infection, chronic steroid use, an organ transplant recipient, or active chemotherapy. Furthermore, let's talk about the TB tests that can be performed to help prevent TB infection. Most often used is the TB skin test. The TB skin test involves 2 visits. On the first visit, the TB test is placed onto the skin of the person receiving the test. The person will then return for the second visit. In the second visit, some days later, the TB test is read. If the TB test is positive, a certain degree of swelling will have developed on the site where the test was placed. Other tests available include a TB blood test, and it is important to note that if a person has had a previous positive TB test result, they do not need to be tested for TB again. Instead, they should be clinically evaluated to see if the signs and symptoms of tuberculosis are currently present in them. Now let's talk about the isolation precautions that we use to help prevent tuberculosis. What we use is airborne precautions. In airborne precautions, we will have a negative pressure room with air exchanges. Furthermore, an N95 or higher level respirator is a core component of airborne precautions. This will include annual fit testing of the respirator or the N95 to ensure that the mask appropriately sits on the face of the personnel wearing the mask. Furthermore, doors to the rooms are to be kept closed, and if the doors have to be opened because the patient has to be transported, a surgical mask is placed on the patient's mouth and nose to help prevent the spread of any kind of droplets coming from the patient. Lastly, let's mention the TB vaccine. The TB vaccine is not commonly used in the United States. This is because it is not entirely effective at preventing tuberculosis, paired with the low rates of TB infections in the US. However, in nations where tuberculosis is common, the TB vaccine might be given to babies or infants. It is important to note that anybody who has received the TB vaccine will test positive for TB in any later TB tests, despite not having an active infection. Now let's take a look at how to put on our PPE to appropriately work with a patient that has an active TB infection. First off, we will wear an N95 or greater. When placing the mask, we ensure that there is an airtight seal at the top of the mask as well as to the sides and the bottom to ensure that it is a proper fit. Furthermore, a gown is to be worn, and this gown will be tied at the top and around the middle. Lastly, gloves are worn and are pulled over the edges of the gown to create a seal. When we take off our PPE, we will take off our gloves. We will take off our gown and roll it inside out. We will then perform hand hygiene, and after performing hand hygiene, we will take off our mask. As part of our learning, we also have a 5-question quiz to help evaluate your learning today, as well as we will have you perform a demonstration of how to put on the proper PPE for the isolation precautions. Thank you all for watching.